Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the question paper that is Sree Chitra Thirunal Institute for Medical Science and Technology, Trivandrum. The examination, the staff nurse examination question paper is what I am discussing, and this is the part 3 of the question paper discussion. So please watch the other videos also that have included the other parts, part 1 and part 2 of this same question paper, and this is the part 3. So let me start the first question, that is 41st question I am discussing. Which one of the following indicates increasing intracranial pressure following head injury? The question is, which one of the following indicates increasing intracranial pressure following head injury? Options are restlessness, decreased pulse rate, increasing blood pressure, widening pulse pressure. So here the correct answer is option A. Option A is the correct answer, that is restlessness. Restlessness indicates increasing intracranial pressure following head injury. So correct answer is option A, restlessness. Then 42nd question, which one of the following conditions is a common cause of cardiogenic shock? Which one of the following conditions is a common cause of cardiogenic shock? Options are electrolyte imbalance, fluid overload, left ventricular failure, hypovolemia. Electrolyte imbalance, fluid overload, left ventricular failure, hypovolemia. So here the correct answer is option C. Option C is the correct answer. That is, left ventricular failure is a common cause of cardiogenic shock. Then 43, question number 43. Which one of the following is the drug of choice in ventricular arrhythmias? Which one of the following is the drug of choice in ventricular arrhythmias? Options are Interal, digoxin, sorbitrate, lidocaine. So here the correct answer is option D, lidocaine. So option D is the correct answer. The drug of choice in ventricular arrhythmias is lidocaine. Okay, now we will move on to the next question. That is, cyanotic spell is a feature of. Cyanotic spell is a feature of. Options are tetralogy of Fallot, VSD, PDA, ASD. So cyanotic spell is a feature of. Options: tetralogy of Fallot, ventricular septal defect, patent ductus arteriosus, then arterial septal defect. So which is the correct answer? Option A is the correct answer. Cyanotic spell, it is a feature of tetralogy of Fallot. Okay, cyanotic spell is a feature of tetralogy of Fallot. Then question number 45. An infant experiencing hypercyanotic spells is placed in. An infant experiencing hypercyanotic spells is placed in. Options are high Fowler's position, knee chest position, prone position, supine position. Infant experiencing hypercyanotic spells are placed in. So here the correct answer is option B, that is knee chest position. Knee chest position. The patient or the infant experiencing hypercyanotic spells are placed in knee chest position. Then question number 46. When a hemophilic carrier female marries a normal male, the chance of their daughter becoming a carrier is. Question is, when a hemophilic carrier female marries a normal male, the chance of their daughter becoming a carrier is. Options are 100%, 75%, 50%, 25%. So here the chance of the daughter of becoming a carrier is 50%. So option C is the correct answer, 50%. Then question number 47. A nurse observes Koplik spot on oral examination of a child with fever. So this is indicative of. Options are measles, diphtheria, dengue fever, whooping cough. The nurse observes Koplik spot on oral examination of a child with fever. So that is indicative of measles. Koplik spot is indicative of measles, and option A is the correct answer. Then question number 48. Census is taken once in every 5 years, 10 years, 15 years, 20 years. Census is taken once in every 10 years. So 48, question number 48, option B is the correct answer. Census is taken once in every 10 years. Then question number 49. The nurse is teaching a client about iron-rich food to be consumed to correct anemia. Which one of the following vitamins has to be supplemented to increase the iron absorption? So which of the following vitamins has to be supplemented to increase iron absorption? That is the question. So options given are vitamin C, vitamin D, vitamin B6, folic acid. So here the correct answer is option A, that is vitamin C. Vitamin C has to be supplemented in order to increase the iron absorption. So option A is the correct answer. Then question number 50. In which one of the following leadership styles the leader values the individual characteristics and abilities of each subordinate? The question is, in which one of the leadership style the leader values the individual characteristics and abilities of each subordinate? Options are autocratic, democratic, laissez-faire, bureaucratic. So here the correct answer is option B, democratic. Democratic is the correct answer. So in democratic leadership style, the leader values the individual characteristics and abilities of each subordinate. So democratic is the answer. Next question. Which one of the following is known as the pacemaker of the heart? Which one of the following is known as the pacemaker of the heart? Options are SA node, AV node, bundle of His Purkinje fibers. So the answer is SA node. SA node is known as the pacemaker of the heart. Then question number 52. The left atrium and the lateral and posterior surfaces of the left ventricle is supplied by. Options are left anterior descending coronary artery, left coronary artery, right coronary artery, circumflex artery. The left atrium and the lateral and posterior surfaces of the left ventricle is supplied by. So here the correct answer is option D is the correct answer, that is the circumflex artery. Okay, circumflex artery is supplying this left atrium and the lateral and posterior surfaces of the left ventricle. Then question number 53. Which one of the following is a potassium sparing diuretic? Which one of the following is a potassium sparing diuretic? Options are spironolactone, mannitol, furosemide, chlorothiazide. So here the correct answer is option A is the correct answer, that is spironolactone. Spironolactone is a potassium sparing diuretic. Then question number 54. Tap digoxin is withheld if the pulse rate is less than. Tap digoxin is withheld if the pulse rate is less than. Options are 40 per minute, 50 per minute, 60 per minute, 70 per minute. So here the answer is option C, 60 per minute, 60 beats per minute. Tap digoxin is withheld if the pulse rate is less than 60 beats per minute. Then question number 55. A nurse who observes absence of P waves and fibrillating waves before each QRS complex on the cardiac monitor will interpret the client's cardiac rhythm as. So the nurse who observes absence of P waves and fibrillating waves before each QRS complex. So what will be the cardiac rhythm of the client? So options are sinus tachycardia, ventricular fibrillation, ventricular tachycardia, atrial fibrillation. So here the answer is atrial fibrillation. Option D is the answer, atrial fibrillation. Then question number 56. The most important risk of deep vein thrombosis is. Options: myocardial infarction, pulmonary embolism, phlebitis, bleeding. The most important risk of deep vein thrombosis. The important risk of DVT is pulmonary embolism. Pulmonary embolism is the important risk of deep vein thrombosis. So correct answer is option B, pulmonary embolism. Then question number 57. Which one of the following interventions should be avoided by the nurse while caring a client with deep vein thrombosis? So if what has to be avoided by the nurse when caring patient with deep vein thrombosis? Options are providing bed rest, elevation of the affected extremity, massaging the extremity, administering analgesics. So which among the following which intervention has to be avoided by the nurse in case of deep vein thrombosis? So the answer is massaging the extremity. So option C is the answer. Massaging the extremity has to be avoided by the nurse when caring patient with deep vein thrombosis. Then question number 58. The normal volume of cerebrospinal fluid is. Options are 25 to 50 ml, 50 to 100 ml, 125 to 150 ml, 150 to 200 ml. What is the normal value of cerebrospinal fluid? So the answer is 125 to 150 ml. 125 to 150 ml is the correct answer. The normal volume of cerebrospinal fluid CSF is 125 to 150 ml. Then question number 59. Which of the following neurotransmitter is deficient in myasthenia gravis? Which of the following neurotransmitter is deficient in myasthenia gravis? Options are acetylcholine, dopamine, serotonin, norepinephrine. Acetylcholine, dopamine, serotonin, norepinephrine. So the correct answer is option A, acetylcholine. Acetylcholine is deficient in myasthenia gravis. Then question number 60. In paraplegia, paralysis involved. Options are all four extremities, only lower extremities, one side of the body, only upper extremities. In paraplegia, paralysis involved. So the correct answer is option B, that is only lower extremities. Paraplegia means paralysis affecting the lower extremities, only lower extremities. So these are the 20 questions that I have included regarding the question paper explanation of this Sree Chitra Thirunal Institute for Medical Science and Technology staff nurse exam. So please like and subscribe the channel, and also you can give your comments in the comment box. So thank you.